12 million Americans have food allergies, and that is still on the rise, according to the Food Allergy and Anaphylaxis Network. Food allergies is a growing health concern. Food allergy occurs when our immune system attacks a food protein by mistake. Eating that food sometimes causes our bodies to release chemicals, one of which is histamine, which causes the symptoms of an allergic reaction. It is very important to recognize a food allergy. The Food Allergy and Anaphylaxis Network states that there are 8 main categories that account for 90% of all food allergies. They are peanuts, eggs, milk, wheat, shellfish, tree nuts, soy, and fish. Peanut allergies are still on the rise, especially in children, whose numbers doubled in a 5-year period. Then the first 2 years of life is when most food allergies begin. Infantile colic, blood in the stool, and poor growth are the symptoms that resemble a food allergic reaction, instead of hives or asthma-like symptoms. Changing the infant's diet is how infant food allergies are often diagnosed. Children usually outgrow their food allergies, while adults tend to have them for life. Children's allergies to peanuts, however, is one that they are much less likely to outgrow. Adult onset food allergies is also on the rise, although causes are unknown. It is thought to be a genetic disposition, but why it is delayed to adulthood is not clear. New methods of producing foods is also being questioned as a cause for Americans' increase in food allergies. There are 2 ways to identifying and diagnosing food allergies: the skin prick test and the Raft blood test. The skin prick test consists of a small amount of the substance being tested to be placed on the person's forearm or back. Then a prick to the skin with a needle allows that small amount of substance to enter the skin. If a person is allergic to the substance, a small red bump will appear within a few minutes at the site of the needle prick. Raft is the radioallergosorbent blood test. It requires a blood sample. The blood is sent for testing for that person's immunoglobulin E antibodies. Immunoglobulin E antibodies are what reacts with the food protein to cause a reaction and releases the histamine. WebMD states that some individuals can develop a rash in areas that come in contact with foods. There are people who are so sensitive to food allergens that the odor of a particular food can cause a reaction. Even a machine that makes several products can be a hazard to a person. For example, if that machine makes Oreos with regular cream filling and also makes the Oreos with peanut butter filling, that person may think that the regular cream Oreo is okay to eat, and then have a reaction because it's the same machine that had the peanut butter filling on it. Symptoms and reactions are quite varied. They range from mild to severe. Mild symptoms of a food allergic reaction include asthma, rashes, hives, itching, swelling, vomiting, tingling into the mouth, diarrhea, and abdominal pain. Severe symptoms of a reaction are often referred to as an anaphylactic reaction and can cause death. Symptoms of anaphylaxis are trouble breathing, wheezing, drop in blood pressure, loss of consciousness, and even death. According to medicinenet.com, the mechanism of a food allergy involves the immune system and heredity. Immunoglobulin E antibody and mast cells located within the body cause the allergic reactions. Allergies are also hereditary, even if the family's allergies are not food-related, like hay fever, dust, pollen, etc. There is a higher risk for food allergies in a person if the family has a history of any allergies. Also, being pre-exposed to the food allergen causes those immunoglobulin E antibodies to form and then attack that food the next time the body is exposed to the food allergen. This attack causes the various symptoms of an allergic reaction. There are no cures for food allergies, but there are different treatments. The easiest, most common form of treatment is avoidance. Simply avoid eating the food that is known to cause the allergic reaction. Next, treatment for mild reactions that helps with all allergic reactions is an antihistamine drug that is sold over the counter. Bronchodilators help with the asthma-like symptoms. For severe reactions, anaphylaxis, an immediate injection of epinephrine, a call to 911, and getting to the hospital is the best treatment. The incidences of people acquiring food allergies is on the rise. Being cautious of what you eat and recognizing the symptoms of a food allergy are very important.